Assalamualaikum and hello everyone. My name is Hitomi. Injury can occur at any time or place, even during a training, practice or competition. An effective first aid for musculoskeletal injuries known as RICE. This acronym stands for rest, ice, compression, and elevation. In this video, I'm going to show you how to conduct a RICE treatment in a taekwondo scene. So let's get started. It's a typical evening. Hitomi and Harumi are practicing their taekwondo kicking at the dojo. Harumi executes a powerful roundhouse kick, aiming precisely at her kicking pad. But as she lands, her right foot twists awkwardly on the mat. She looks in pain and grabbing her ankle.
Ow!
Harumi, are you okay?
I think I twisted my ankle.
Before beginning any treatment, it is critical to determine the extent and severity of the ankle sprain. Determine whether the sprain is mild, moderate, or severe based on the signs and symptoms such as pain, swelling, bruising, and capacity to bear weight. Can you tell me where it hurts the most?
It's alone here.
Hitomi discovered that Harumi's ankle had slight pain, swelling from inflammation, soreness, and a limited range of motion. We may classify this ankle sprain as grade 1. Grade 1 ankle sprain is not a serious injury, thus we can apply the RICE principle. The first component of RICE is rest. It's important to stop any activity to prevent further damage and allows the body to start the healing process. Next is ice. Use an ice pack wrapped in a cloth and apply to the injured area helps reduce swelling and inflammation and provides a numbing effect to relieve pain. Apply it for 15 to 20 minutes every 2 to 3 hours during the first 48 hours after the injury. Make sure to protect the skin with a cloth or towel to avoid frostbite. The third step is compression. Wrapping the injured area with an elastic bandage helps to minimize swelling and provide support. Be careful not to wrap it too tightly as this can restrict blood flow. To check the circulation, squeeze the toenail for 5 seconds. When you let go, the color should return within 2 seconds. If it doesn't, it means the bandage is too tight and you need to loosen it off and reapply it. The final component in RICE is elevation. Use pillows or cushions to prop up the injured limb, especially while resting or sleeping. Keeping the injured area elevated above the level of your heart helps to reduce swelling by allowing fluids to drain away from the injured side.